Imagine a moment when everything hangs in the balance, a critical turning point in a person's life. In today's video, we're about to unravel one of these pivotal moments, a matter of life and death. Welcome as we explore the mysterious world of strokes. So what exactly is a stroke? Well, it's like a problem in your brain. Picture your brain as a hungry machine that needs food and oxygen to work properly. Sometimes the blood that brings this essential stuff can't reach your brain because of a glitch. When that happens, your brain cells start to die pretty fast. But here's some good news. Things have improved and fewer people in the United States are losing their lives to strokes. Plus, there are treatments that can help lessen the damage it does. Recognizing the signs and symptoms of a stroke is crucial, as timely treatment can make a significant difference in the outcome. If you suspect that you or someone around you might be experiencing a stroke, pay close attention to when the symptoms began, as some treatments are most effective when administered soon after the onset of a stroke. One of the primary signs of a stroke is difficulty with speech and comprehension. You might find yourself struggling to speak coherently, slurring your words, or having trouble understanding what others are saying. This confusion and difficulty in communication are alarming indicators of a potential stroke. Another common symptom is paralysis or numbness, typically occurring on just one side of the body. This can affect the face, arm, or leg, and you may experience sudden weakness or the complete inability to move these body parts. A simple test is to try raising both arms over your head simultaneously. If one arm begins to fall or feels weak, it could be a sign of a stroke. Additionally, when attempting to smile, you may notice that one side of your mouth droops, further confirming the possibility of a stroke. Problems with vision can also be a significant warning sign. You may suddenly experience blurred or blackened vision in one or both eyes, or you might see double. These visual disturbances can be unsettling and should not be ignored. A sudden severe headache is another red flag for a stroke. This headache can be accompanied by symptoms like vomiting, dizziness, or altered consciousness. If you or someone you know experiences such an intense and unexpected headache, it could be a sign of a stroke. Lastly, trouble with walking or maintaining balance is a common stroke symptom. You may find yourself stumbling, losing your balance, or experiencing sudden dizziness or a lack of coordination. These difficulties in mobility are concerning indicators that should prompt immediate attention. If you ever observe any signs or symptoms of a stroke, it's absolutely critical to seek immediate medical attention. Even if these symptoms appear to be transient or vanish altogether, never underestimate their significance. Remember the acronym FAST to help you respond promptly. Start by checking the person's face. Ask them to smile. Is one side of their face drooping or appearing noticeably different from the other? This facial asymmetry could be a telltale sign of a stroke. Next, assess their arms. Request that they raise both arms simultaneously. Is one arm drifting downward involuntarily, or is one arm unable to rise at all? These arm-related issues can be indicative of a stroke. Moving on to speech, ask the person to repeat a simple phrase. Pay close attention to their speech. Is it slurred or strange in any way? Any difficulty in forming clear words or sentences can be a strong indication of a stroke. Lastly, time is of the essence. If you notice any of these signs, facial drooping, arm weakness, or speech difficulties, do not hesitate. Call 911 or seek emergency medical assistance immediately. Acting swiftly and decisively can make all of the difference in the outcome when dealing with a potential stroke. Your quick response may well be a lifesaver. Strokes happen mainly for two reasons: when an artery gets blocked, called an ischemic stroke, or when a blood vessel in the brain leaks or bursts, known as a hemorrhagic stroke. Sometimes people experience a short disruption of blood flow to the brain, which is called a transient ischemic attack. Thankfully, TIAs don't cause long-lasting problems. Understanding these detailed signs is not just about recognition, but also about empowerment. It's about knowing when immediate action is required to preserve health and even save lives. If you or someone you're with experiences any of these signs, don't hesitate. Seek medical assistance without delay. Your quick response could make all the difference in a potential stroke situation.